I'm Dr. Hansen, and today we're going to be talking a little bit about liposuction. There's traditional liposuction, which is generally done in the hospital or in a surgical center. But today there's been a new process called tumescent anesthesia, which has allowed us to actually do areas of the body in the clinic. So what are the advantages to doing it that way? One of the things that we do is we actually use a little bit smaller cannulas as well. You'll quite often see that in the hospital setting, they use quite large cannulas. They want to get it out a little bit faster, get you out of general anesthesia, to where we can actually take a little bit more time and actually use a little bit smaller cannula. Often, if I'm doing like a face or a neck, I'm actually going to use cannulas. They're about the size of the barrel of this pen, the tip of this pen. But then the ones when I'm doing liposuction itself for like a bigger area such as an abdomen or thighs, that's about the biggest it gets, is 4 millimeters in size. So that's actually a big advantage. We can get smoother results by doing it that way. What are the areas we can do? Because everybody always asks that. We can do the neck. We can actually do sometimes the jowls. And then we can also do the male chest. So for men who have developed a little bit of extra fat in that area as they've aged, or they have a little gynecomastia without having surgical scars, which is great. But then on top of that, we can do the upper and lower abdomen, the flanks, the hips, the posterior bra fat, the medial thighs, and believe it or not, even the calves and the ankles. And occasionally we'll even do a little bit of fat transfer to the buttocks. That's one of the big things that's been asked for over the number of years. I don't like to do large amounts of that because I don't think it looks natural, but I do think that we can do that for a lot of the women that actually can show benefit to rounding out their bottom. Another thing that's important with doing it in the clinic and using the smaller cannulas, it actually allows you to have much less downtime. We have our patients wear their compression garment for anywhere from 3 to 5 days in most cases, where you'll find most of the surgical centers and also the hospital setting type of liposuction, they quite often will ask you to wear your compression garment for weeks. We don't feel that that's necessary because of how we do the procedure. I think that it's, again, safer, but also will get you back to work much faster. So generally I ask patients to take about 2 days off in most cases, unless they have a real heavy working, lifting type of job. They might need a little bit of time. Now, when it comes down to working out, patients might have to take a week off, but I'm not asking for them to take an entire week off of working out. I'm asking them just to slow it down for that first week or so. They can start adding their exercise routine back. After about 2 or 3 days, just add it back slowly, start walking, getting a little bit of movement, and then start going a little bit harder as they're able to over that next week or two. I was actually trained by Dr. Jeffrey Klein, who is the inventor of tumescent anesthesia and tumescent liposuction in California. He developed the process about 15 to 20 years ago. If you're considering liposuction, please contact us at the clinic for your free consultation.